Okay, so the topic I was given today, I'm Christine Hawke. I'm a veterinarian and I work purely in dental practice. So what I just wanted to talk about is the way that sort of veterinary dentists tend to approach feeding dogs and cats. It may not be as contrary as everyone was hoping, because I'm not rabidly anti-bone, which I think is what everyone thinks most dentists are. What I see in life is that everything you do, you have to look at risk and benefit, okay? So as long as people are aware of the risks and the benefits of what they do, they're really free to do whatever they want. All of us really want our patients, whether we're human dentists, human medical practitioners, or veterinary surgeons, want our patients to have happy, healthy lives and happy, healthy mouths. And so we sometimes come at this from different points of view, but this is kind of the point of view that we have. So the figures really are that of our domestic pet dogs and cats, about 80 to 85% of dogs and 50% of cats will have some form of dental or periodontal disease by the time they're 3 years old, which is quite a startling figure. It's quite a scary figure, and it means that, you know, it is the most common disease that they have. Now, when we feed for dental health, obviously there's a lot of factors that Richard talked about general health. People have talked about the environmental enrichment of different diets, and totally agree with all of that. But if you're coming at it from a purely dental point of view, there's a few things that we just try and get across to our clients or the owners of our patients to make sure that everything is done with the best interests of the animal in mind. So the way that we look at it is that basically things like caries, so the diseases that we tend to see most commonly, caries is actually rare in dogs and almost never seen in cats, okay? A lot of that is because they're not fed high sugar diets in most cases. The few cases of caries or dental decay that I've seen in dogs were ones that were fed boiled lollies as a treat, which is kind of inappropriate even for children, let alone dogs. And I had a really sweet little poodle that the elderly owner used to have a cup of tea with 3 sugars and a biscuit with it every afternoon. And it actually managed to develop dental caries. And there's lots of reasons why it's rarer in animals. I know that a lot of it's to do with the microbiota in the mouth, which obviously there's people today that do a lot more work in that than I do. But a lot of it is also the pH of the mouth is a lot more alkaline, and that the shape of the teeth is different. So particularly cats don't really have any flat occlusal surfaces because they've developed as carnivores. They're such amazing killing machines that they just literally have fangs to kill, teeth at the back to slice that we call carnassials, or they're the premolars and molars that work like scissors, and down it goes. Okay, so they don't have anywhere for things to hang around. But having said that, periodontal disease is very common. Probably the other most common thing that we see would be dental fractures. Okay, so they're the things that we see as issues for animals, and so they're the things that when we're feeding we need to address in a major way. So as far as the natural diet versus the commercial diet debate, I think if we take out of the equation that animals are getting the nutrients that they need, so we're not going to talk about animals getting dental disease because they're so protein or calcium deficient. If they're getting a complete and balanced diet, I guess what it comes down to is what it's actually doing for the mouth physically. So the things that we look at for dental health is whether we can control plaque, because plaque is the main cause of periodontal disease. In dogs and cats, as it was alluded to before, there are huge genetic influences on periodontal disease, particularly between the breeds. And we've got a lovely kind of population of dogs and cats where the breeding and the interbreeding gives us a great model for looking at those things, but unfortunately the genes behind a lot of these haven't been researched. But the way that diets tend to work is by controlling plaque. So when we talk about a risk to benefit, anything we feed, we need a benefit, if it's going to be dental, for it to control the plaque on the teeth. And so there's 2 ways that most of the foods tend to do this. Mechanical, where they abrade the plaque off the teeth. So the main action that we see there is chewing. So chewing action is obviously very beneficial for controlling plaque, but the tooth has to sink right into the material, whether it's meat, whether it's a type of food. It has to actually go in and out of the food for that to then clean the plaque off the tooth. The other way that it can be approached is from a chemical means, and so this is something that's generally not seen with raw diets, obviously because we're trying to get away from chemicals, but with some of the commercial diets they will have chemical means of trying to protect against dental disease. So we'll go through a couple of those. So when we look at natural diets, so the feeding raw meat, feeding bones, raw meaty bone diets, as Richard said, the thing is that there's really no solid research into the benefits or how these affect animals, but there are some studies where they've looked at the effect of natural diet on dogs and cats in natural habitats. So there's 3 studies that are quite interesting. There's a lot of studies that don't really stand up scientifically, but there's 3 studies that all showed the same result, and they're all really interesting, 1 in dogs and 2 in cats. So one was done in Africa on the African wild dogs by Gerhard Steinkamp and Cecilia Gorel, who are 2 veterinary dentists. And what they did was they looked at the wild dogs that have been eating, wild diets. They're completely wild animals, and looked at them and looked at things like calculus and the presence of periodontal disease. And the interesting thing, these animals, their natural diet was mainly things like antelope. Okay, so they looked at the stomach contents, and that's what they'd been eating. And what they found was that the rate of periodontal disease was not significantly different to what was being seen in domestic dogs in those areas, okay, so in the same country. Which is really interesting because they also found that the amount of calculus on the teeth was significantly lower in the wild dogs than it was in dogs being fed commercial diets. And so this is kind of weird because the teeth look great on the surface, but what they found when they looked at periodontal disease, not just mild gingivitis, but things like bone loss and loss of teeth due to periodontal disease, what they found was that there was no difference in the 2 populations. 2 studies were done in cats. So there was one done in Australia, which was done by David Clarke in Melbourne, and what he did was look at cats that were being fed commercial diets. So he just chose the first 20 adult cats that came into his clinic that had been fed commercial diets, so whether it was wet or dry, and had not ever had any dental care, because obviously that's going to change what we see if we do dental care on them. And he also looked at cats, the feral cats that were being culled from Kakadu National Park. And again, the same thing was found, the rate of periodontal disease in both, and obviously with humans it varies a lot with age, and in animals it varies a lot with age as well. We get a much higher prevalence of disease as the animals become older. But these animals, particularly the wild ones, were fairly young because most of them don't last more than about 4 or 5 years, particularly if someone's trying to cull them. Okay, so they found that the rates were about 40% for periodontal disease in both, for moderate and advanced periodontal disease. And again, they found that the incidence of calculus was a lot lower in the feral cats compared to the domestic cats. And the 3rd study was a really interesting one that was done in Marion Island, which is a sub-Antarctic island off the coast of Africa. And that was done by a veterinary dentist called Frank Vestrati, and he looked at a lot of things with these cats. So these were cats that are actually domestic stock, so they have the same genes as domestic cats in general, that were released onto the island when people were doing research there, and they took all their pet cats over and then they let them go. I don't know why they let them go, but it's at the point where they've had to do massive culling to try and preserve the native fauna on the island. These cats, their main diet is birds, so when they looked at their stomach they would find a lot of bird life, bones and all that sort of stuff, the whole bird. And again they found the same thing, that the rate of periodontal disease was similar to what we see in our domestic counterparts that are on normal diet, or sort of commercial diets, I shouldn't say the word normal, but what owners perceive as a normal diet for pets. And again, the calculus levels were lower. So the interesting thing is that even though we're getting lower calculus, and that's often what people do see on the teeth, the rate of periodontal disease wasn't significantly different. The other interesting thing from these studies that they found was that the rate of dental fractures in the wild animals, that fractures weren't reported in the Clarke study from Melbourne, but from the one from Marion Island and the one with the African wild dogs, is that about half the animals did have dental fractures. Okay, so they may get dental fractures in their front teeth from fighting, I guess if they're in a wild place that maybe they don't know how these fractures happen, but they got a lot of fractures up in the carnassial, the big slicing teeth at the back, particularly the upper 4th premolar. And that tooth is one that we see every single week, almost every single day in veterinary practice. So this is a tooth that dogs that are eating hard objects do break and they do get complicated fractures, so they go right into the nerve canal or the pulp chamber, and they do have these teeth die and they do cause abscessation. And that is one of the most common things that we actually treat in veterinary dental practice, are these broken teeth. And so I guess when you look at it, there are sort of benefits to it, and those have been alluded to using a natural diet in animals as far as their satisfaction and the way they eat and their weight control and things like that. But there are risks to it as well, okay? So there are risks of dental fracture. There is probably the biggest risk that we do see. And my kind of thing that I say to people, and it does come down to the size of the bone, as Richard alluded to, you've got to match the size of the bone and the softness of the bone. So it's very rare that we would ever see a cat break its teeth on a chicken neck, okay? But a lot of people don't understand this, and so when they're told or they hear the thing, give your dog bones, they just go bones, they grab the bone that they see. It's obviously not the right size for the dog, but they can get issues with that. So my kind of rule of thumb is that things that are safer, because nothing's completely safe, okay, and I'm not a nanny state, people can take their decisions based on risk to benefit, are things that can bend, things that you can dent, so you can put your fingernail into them or you can dent them with your finger, or things that will crumble when the animal eats them, okay? The only flip side of that is that the hospital that I work at also has a 24-hour emergency service, and the things that I say are safer are the things that tend to get stuck in their gut on the way through. If they can break it into pieces and inhale large chunks of it, they're the things that we're pulling out of their stomach. They can cause perforations, and we have animals that actually die from bone ingestion. So it is a kind of catch-22. You've got to be very careful what you give them. It doesn't mean don't give them raw diets and don't give them bones. It just means be really, really careful. And obviously for me, business-wise, it'd be fantastic to say give them all these big hard bones, because I would be kept in business for a long time. But it really is one of those things that people need to be educated what they're giving. The other thing that we sometimes see with it, so apart from the issue with breaking teeth, is just to remember that they can get infections from it, so particularly salmonella. So we're always trained, don't cut chicken on the chicken board and then cut salad, things like that on it. Even human grade food does have infection in it, so you've got to be a little bit careful about telling people how to handle these foods and making sure that, animals do get it, and animals fed on raw diets do shed more salmonella. The other issue that you get is if people are immunosuppressed, you've got to be careful about what you recommend they have, because there is a human health risk if animals are shedding salmonella. As far as if you're not going natural, the types of commercial diets, if people choose to feed a commercial diet, a lot of those have actually been designed to make the animals chew. So there are kibble that are quite large. Just chewing a dry food doesn't necessarily keep their teeth clean. I think we've all kind of worked that out now, because if it did, then there would be no issues in these animals that have been eating dry food for decades. But it's just being careful about the size of the kibble so they have to chew it. The chemical means that are sometimes used, so some of the foods that you read will say that they have got dental benefits, but they'll be tiny little kibble. What they do is they spray them with polyphosphates, which bind the calcium that's in the saliva that causes the plaque to harden into calculus or tartar, okay? Now, tartar is not the cause of periodontal disease. It can predispose to it, but those foods are necessarily, even though they're controlling the calculus, they're not necessarily controlling the periodontal disease or the plaque. So you've just got to be careful when people are looking at the types of foods they're feeding, the mechanism that they're working through, is that it's mechanical rather than chemical, or you can use both, but you really need to have a mechanical form. And that's where chewing is brilliant. There's lots of chews that they can use. As Richard says, a lot of them cost more than a chicken wing, but you've got to weigh up kind of the risk to benefit for each animal and what size is going to work for them. And the other thing, you might find kind of random, and you can talk to me about it later if you're interested, is we actually can teach animals to have their teeth brushed. We're yet to find a self-brushing cat, but I do have a friend who has 2 ridgebacks that chase him down the hallway because they love their power brushes, and when they chew on the brush, they're flossing. And don't give them chewing gum, that's the other thing. It's full of xylitol, little poison, which Mary will tell you about later.